Good morning, everyone. Thank you for your patience and welcome to today's webinar. Just a little bit of admin to cover. The session will be 30 minutes long. Everyone's been automatically muted. Well, if you do have any questions, please feel free to pass them through on the chat function, and that'll also be used for the Q&A later on in the session. There's some handy downloads if you want to have a look at them. And the recording of the presentation will be sent through to everybody. I'd like to introduce our speakers today. From LIMA, we have Mark Howey, one of our senior members of our sales team, Martin Ingham, our technical director, and our guest speakers, Mark Hutchinson, Executive Chief Digital and Information Officer at Gloucestershire Hospitals NHS Trust, and Martin Hosken, Chief Technologist of Cloud Solutions at VMware. An impressive lineup, I'm sure you'll agree. I'd like to pass you over to Mark Howey.
Thanks, Chris. And a nice introduction. Yeah, I'd say impressive in terms of the other three guys, maybe, but yeah, I'm really excited about the session today. To be fair, and welcome to everyone, attendees and panelists alike. I'd like to thank you all for taking, an hour or so out of your busy days, to come and join us. We've run a number of webinar events recently in a series around healthcare and the NHS, and this is probably the flagship one for me in terms of sort of the story and some of the successes and information we're going to share with you today around specifically around what we've done with Gloucestershire, and welcome to Mark Hutchinson, CDIO at Gloucestershire. Later on we're going to do a Q&A, and he's going to share with us a lot around the sort of the kind of the improvement on patient outcomes that this technology has helped the trust to deliver, and kind of how it's helped them to accelerate their digital transformation journey. So that'll be really interesting at the back end of the session. I'll be handing over to Martin Hosken in a few minutes. Obviously, Martin, Chief Technologist from VMware. He's going to talk a bit more about how sort of hybrid cloud architecture and sort of leveraging that hybrid cloud capability can help to really transform how customers are delivering healthcare and delivering sort of care services to their patients. And then in between those two guys, Martin Ingham, so technical director at LIMA. I've worked with Martin for over 10 years, and focusing predominantly on our healthcare business. And yeah, Martin's got a wealth of experience in sort of architecting solutions, and he's going to talk in a bit more detail, lower level, about what we've done with some of this technology, and how we've helped some of our customers, become successful with it. So yeah, as I mentioned, I'm going to take a few minutes before I hand off to Martin. I did look at the delegate lists a couple of days ago, and noticed a lot of familiar names in there, but also quite a number of new ones. So I'm conscious that a lot of you, whilst you might have heard of LIMA, may not know too much about us. So I just wanted to take a few minutes to give you a little bit of an overview, high level, about LIMA, as I said before, handing off to Martin from VMware. LIMA, we've got 25 years experience, I think 26 now years experience in delivering, IT infrastructure solutions, managed services over the last 10 to 15 years, private, public and hybrid cloud solutions. But when I joined the business nearly 10 years ago, which is a bit frightening to say out loud now, but there was a real focus around the NHS. If I'm being honest, at that point, I think the business had dipped their toe in the water a little bit, and we decided to build a dedicated team just focused on dealing with healthcare and the NHS. We understood that we needed to develop not just the expertise that we had around technology, but the insight and experience with NHS trusts and within the sector to really understand how we can help to underpin technology roadmap and strategy to deliver better patient outcomes, and and help frontline healthcare workers get quicker and faster and more rapid access to patient data to deliver better care. Whilst we've got a proven track record of delivering these infrastructure and hybrid cloud and public cloud solutions, I think for me the key thing that has helped us to be successful is about our focus on developing long-term partnerships, strategic partnerships with our customers. And it's a phrase, certainly more in the last couple of years, you hear more and more MSPs, coining, and we like to work in partnership with our customers. What does that actually mean? How do we go about ensuring that we are actually working in a true partnership? I mean, for me, it's about that insight that I talked about. And how do we gain that insight? Well, it's about the engagement methodology that we follow. We've developed a sort of a specific way of engaging with our customers, particularly in healthcare, to ensure that we can get that insight that we need to then develop the right solutions that are going to underpin, help them to achieve their objectives and underpin their vision. So, we start by talking about outcomes, vision. What is it the organisation is looking to achieve? And how are they going to get there? And that's through engagement with C-level, right through to senior management, right through to the nurses and doctors who are delivering the healthcare on the front line. And I think all those conversations don't centre around technology. In fact, it doesn't really come into it. We want to understand exactly what the direction that the organisation needs to take to improve outcomes. Once we've got that, we then start to go a little bit lower level and look at business and IT challenges. Areas in the organisation and the IT infrastructure and the systems that are holding the organisation back from delivering on those objectives, which ultimately, transpire to delivering the vision. I think once we've got that insight, as I mentioned, coupled with our experience and expertise, we then can really, develop and design, technology roadmaps that underpin and deliver tangible outcomes, which ultimately improves patient care. So, I mentioned we deliver a range of technology stacks to our customers within healthcare. Everything from enterprise networking, digital workspace, and end user compute. Some of which we've done with the guys at Gloucester, and also public and private cloud. But today, the focus for us is really around VMware software-defined data center and hybrid cloud platforms, and how we've partnered with VMware and our customers to deliver this technology set successfully. I think one of the big accolades for me, I think, was we were the first in the NHS, first partner to deliver software-defined data center into the NHS some 2.5 years ago with Gloucester, and since then we've had many successful engagements in sort of implementing this technology to deliver and improve outcomes. A couple of examples I wanted to call out before I pass over to Martin here, and again, Martin Ingham's going to talk about the technology in terms of what that does for organisations from a technology perspective. I wanted to just call out some, what I would say, more organisational outcomes that we've seen, our customers enjoy, through the deployment and investment in this technology. So, things like the ability to rapidly provision and scale systems to accelerate digital transformation, particularly around things like record. I think everyone in the room will be aware of the importance of digitising patient records, and whilst obviously LIMA don't deliver the EPR platform itself, if we can deliver an infrastructure that helps to accelerate the time time to market for those applications, then obviously clearly that's a significant value to NHS trusts to start to utilise that technology. Another couple of areas that are really exciting, and we've seen customers looking at over the last couple of years around the hybrid cloud piece. Data is becoming really, really important to healthcare, and in terms of looking at how ways of manipulating data, using things like data analytics and AI to help to project, if you apply a particular clinical pathway to a patient, what kind of outcome will that deliver for that person? Will it improve their ultimate outcome and the healthcare that they're getting? So I think the ability to stretch these platforms into public clouds and tap into these services, these AI and data analytics services, really, really powerful, and we're seeing a lot of customers moving towards that area with the use of this technology. There are many more, but I think finally I'd also like to sort of cover off, and as ever when we're engaged with NHS, the pandemic and COVID is at the forefront of all of our minds. It has been for the last couple of years, and unfortunately it looks like it will be for the foreseeable future. But I think again, talking about the rapid provisioning capabilities and the scale of these platforms, the ability to respond to outside pressures like pandemics, and rapidly mobilize, the workforce in record-breaking time to give people access to data from wherever they are from a staff perspective, but also to allow vulnerable patients to have remote consultations and that kind of thing. And Mark Hutchinson is going to talk in a little bit more detail specifically about how Gloucestershire have utilised this technology to really deliver on that. But yeah, for me, I think technology is exciting, to a degree, but I think for me, what excites me is what that delivers to organisations in terms of value and improving outcomes. And I think this technology is quite unique and quite at the forefront of what we're doing around, in that area. That's about it from me. Thanks for listening. I'll see you later on for the Q&A with Mark Hutchinson, and I'll pass over to Martin Hosken.
Yeah, thanks, Mark. It's a pleasure to be here, and it's just such an important topic. And obviously the pandemic has escalated everything, but every single NHS trust that I work with, and this is actually the second conversation I've had with NHS trusts today, every single NHS trust is really focusing on the next generation of digital transformation in order to improve patient care, patient outcomes. And in many cases, in pretty much all NHS trusts across the UK, VMware is the incumbent technology. But at the same time, NHS trusts want to be able to leverage other technologies, public cloud technologies, the best that public cloud has to offer, to be able to build and extend the usefulness of existing applications. And that's really where VMware is focused now, is extending our footprint, extending the VMware incumbent technology into public cloud. So if we could move to the next slide, that'd be great. So these are the four main focuses of areas from a healthcare perspective. There's the modernization of existing infrastructure which exists in your data centers. And these might be in colo environments, they might be in hospitals or clinics. But we have to prepare those for the next generation of applications. We need to get them ready, modernized, and that's really been a challenge over the last few years for NHS trusts to have the funding to be able to do that. We have to, where appropriate, move workloads into public cloud. And this might be a small number of workloads as appropriate, might be a large number of workloads. But that ability to move workloads into infrastructure that is consistent with on-prem, having VMware on-prem in your data centers, having VMware in public cloud, that consistency from an automation and operational perspective is really key. And then how do we transform applications? How do we build and modernize applications using this public cloud technology? And I'll provide some examples of that later on. And then there's the new app development. We have to build new apps. We have to continue to innovate and develop new applications. How do we do that? And we all know that the way that apps are designed and architected is changing rapidly. We're moving from into a more microservice, into a more serverless, into a more PaaS world from an application perspective. How do we keep up with that? And how do we build apps efficiently and securely in that world? So next slide then, great. So the reality today is that most NHS trusts look like this. They have hundreds, sometimes thousands of applications, and they're all different. They're using different database engines, they're using different technologies, serverless, containers, virtual machines, and at the same time, they're running a whole range of different application frameworks from Java, JS, Go, PHP, etc., .NET, etc. Put that alongside multiple data centers, multiple data center providers in many cases as well, clinical sites, hospitals, and such like, different types of hardware, x86, different vendors, IBM mainframe systems, IoTs, different cameras on different sites, different security systems for scanning your badge. How do we manage all of that together? And then bring in the world of public cloud, where you've got 5 or 6, depending on how you count them, major public clouds offering services across the UK, across the globe. That just adds an additional layer of complexity. So how do we make all of this easier and more simple to manage? So we have the next slide. So VMware started this journey of moving all of our platform with the ability to run our platform in public cloud. We started with AWS around 5 years ago, and now, of course, we've got Azure VMware solution, we've got Ali Cloud, although that's not available in EMEA at the moment, Google Cloud VMware Engine, Oracle Cloud VMware solution, and of course, IBM Cloud is a long-standing partner of VMware. VMware Cloud on AWS is a VMware service, and that's not to imply it's better than any of the other services. It is just architected and built, developed, etc. by VMware internally. We of course allow our partners to sell it, and AWS themselves, of course, but it is a VMware service, and that's the slight difference. And what we have here is the ability to run consistent VMware platforms across all of these public clouds. So we have the next slide. And what that gives us is a unique capability. VMware is the only vendor able to offer this consistency across all of these different public clouds. And that, of course, makes it unique, whether it's from a consistent API perspective, automations and operations, having the same endpoints from a cloud perspective in every single public cloud that you can manage consistently, manage resources, manage automation, manage operations. But because it's consistent across every public cloud as well, as you saw a moment ago, we can migrate workloads. And when I say migrate workloads, I don't mean power it off and copy the data and then power it back on. I mean live migrate workloads from Azure to AWS, or from AWS to Google, or from Google Cloud to a VMware partner, or to back into your data center. Complete and total flexibility about where those applications live. And that provides that capability to burst into public cloud, truly burst into public cloud, extend your footprint, your VMware footprint into public cloud, expand it, contract it as meets your requirements from an operational perspective, from a migration perspective. Next slide, please. So I get asked this question every single week. Why would I run VMware in public cloud? Why would I not just run the incumbent, EC2 or Azure VM or Google Compute Engine? What do I get from a VMware perspective? And these are the four categories, the four key things I like to talk about. But it really all comes down to flexibility and choice. The ability to accelerate migrations. We have customers migrating hundreds, thousands of workloads within weeks and months, not years, as it's typically the case with a native public cloud migration. It really simplifies that journey because it's VMware to VMware. And VMware technology, HCX specifically, abstracts the VM kernel even. So you can go from very old versions of VMware to very new versions and back again without really any downtime or any risks to the application. You can choose where those apps reside. It's sometimes very difficult to understand where the best place to place an app is. And that's whether it's from a performance perspective, whether it's from a data sovereignty or data residency perspective. There's lots of factors that come into that, and those factors change. We know, for example, the UK government is about to start rewriting GDPR, and I'm actually involved in the committee that does that. But what if that changes? What if where you run applications today is not where you need to run them tomorrow? That flexibility and control is really key here as well. VMware on our platform, as most of you will know, support a much huger range of legacy operating systems as well. Older versions of Linux, very old versions of Windows 2000, 2003. In some cases, even DOS. We support. We have customers running DOS on vSphere today. And that is much broader than the native public cloud offerings. Even Microsoft only support a couple of versions of their Windows Server operating system and desktop operating system, where applications are legacy. And there's multiple terms here: heritage center, legacy apps, whatever you want to call it. Those exist, and our NHS Trusts are dependent on those applications, and we can't change those applications easily. We can't just upgrade to a latest version of Windows and hope for the best. We have to look for strategies around security and maintaining those. And again, VMware with NSX, microsegmentation can really offer that. And as we've seen with trusted partners like LIMA, who have the skills and have the experience of delivering this with multiple with multiple NHS trusts across the UK, you can really rely on their expertise to actually be able to deliver these technologies and not just read about them, or it's not just slideware, it's actually being delivered to deliver them as well. The next slide, please. So we've all seen the change over the last 18 months. It's, I'm not going to reiterate, I think we hear enough about it, but I have family members who work for the NHS, and 18 months ago it would have been unthinkable for them to work from home, but today they do. So that changes everything. It makes the security landscape more complicated when you're protecting devices coming from hundreds, thousands of locations, people's homes, people's coffee shops, local coffee shops, people's friends working on their kitchen because the kids are at home and they can't work at home. Really, that level of flexibility is what we're going to need from NHS IT departments in future, and delivering that is really fundamental to the core infrastructure and the security technologies that are built around it. And VMware, as I'm sure many of you know, are very, very focused on that. We have the whole portfolio from a security perspective, from an infrastructure perspective, from an application delivery perspective. And that is really the whole part of our strategy, alongside modern applications and our Tanzu portfolio, if you've heard of that, with the ability to run consistent application frameworks across all of these public clouds, both natively and from a VMware perspective as well. So next slide. I think this is coming towards the end of my part. So key here is that ability to choose, that flexibility, choice, and freedom to choose. Many public cloud migration projects fail because of the pressure to complete them quickly and on a particular target timeline. By having this VMware approach, where you have VMware in your data centers, VMware in public cloud, but also being able to leverage native public cloud services, it takes that pressure off. So you can migrate those applications as appropriate at their own pace. And if things change, if you need to move applications back on-prem or even to a different public cloud, cloud exit is a reality, a true reality with this strategy. Anyone who's tried to move an application from a native public cloud to a different one will know the challenges involved in that, the complexity, the risk, the downtime, etc., that's associated with that. We can take that away through this, effectively incumbent VMware technology that many of you already have inside your data centers. So thanks. Is that the last slide? I think it was the last slide. I should have checked.
It is, yes. Thank you, Martin.
Yeah, cool.
So thank you, Martin. Very insightful there. I'd like to pass you over to Martin Ingham now.
Thank you, Chris. So I'm going to spend the next 10-15 minutes talking a little bit more about how we approached delivering the technology that Martin just talked about with Gloucester in particular, but also giving some awareness of the work we've done with a couple of other trusts as well, and where we're also delivering this technology. And like Mark said at the beginning of the webinar, we're very, very proud of the work that we've done, particularly with Gloucester, but all of our NHS trusts, and the outcomes and the real change I think that it's delivered. And hopefully you're going to hear that over the next kind of 30 minutes from myself and Mark. But I'm also very kind of fortunate. My wife's a nurse, so I understand and hear firsthand pretty much every day the challenges and the problems that clinical staff are facing, not just patients, but the clinical staff are facing with technology adoption in the NHS, and sometimes how that's hindering patient care. And we were able to kind of harness some of that knowledge, as well as the approach I'm going to talk about in a moment, to really, I think, make a big difference to the people of Gloucester and that region. So I'll talk to you first initially about our approach and how we engaged in particular detail with Gloucester. And irrespective of whether it's Gloucester or any other NHS trust, it's really, really important to us and to our customers that the decisions that we make around technology and what we're trying to achieve is delivered from an informed approach. So making sure that we understand in detail and going beyond the technical requirements and what our customers are wanting from the engagement LIMA and the solution that we're going to deliver. And we're very, very fortunate with Gloucester. They had a very, very mature approach in terms of how they wanted to engage with a partner like LIMA. And I mean, at the beginning, they came with kind of standard requirements in terms of the challenges that they were faced around problems with stability in the environment, challenges in terms of scale and responsiveness to be able to deliver new systems and clinical applications, as well as performance challenges. So quite kind of standard technical issues that the majority of trusts and even non-NHS organisations are facing. But through the broadening of that engagement, and by broadening I mean being able to engage with Gloucester on multiple levels, both at a technical, a strategic, and the clinical level, it really allowed us to uncover much more that could be done with the solution, the investment that Gloucester were wanting to make. And that took the form of various technical workshops with the technical people, and we worked really closely with Gloucester's transformation program manager, understanding some of the wider initiatives that were going on within the trust, and also inviting certain key clinical representatives to the kind of consultation process with us to really understand the day-to-day challenges. So this wasn't just about us listening to the technology side, it was also making sure that we could hear firsthand what challenges those clinicians were facing in their jobs and how that was impacting patients, and using that information to deliver a solution and technology that really did make a difference. And we'll talk a little bit more about the outcomes later. But that broadened the kind of need to for this technology, and that bled into areas around security and how we could secure legacy applications better, potentially how we could deliver more efficient ED clinical access, initially for that ED department. But that decision actually was fundamental to some of the benefit that Gloucester had when COVID hit. When we were putting this solution together, clearly we didn't know that was coming, like nobody did, but it had a major impact in some of the agility and the flexibility that Gloucester were well placed to take advantage of when COVID hit last year. It was also really important that we were transparent around what was and wasn't possible. Obviously, there's lots and lots of things that can be done with technology, and sometimes you have to be realistic, both with the customer, in this case Gloucester, and also Gloucester with us sometimes, in terms of what can and can't be done within the time constraints or the budget constraints. But we always have one eye on how you can build a roadmap with this technology. So this isn't just about delivering something at that point in time, but how this technology and this platform can grow and develop over the 3-5+ years that Gloucester are wanting to make use of this. And that roadmap is being delivered today. We're kind of 2 or 3 years into that roadmap, but continuing to evolve what that platform is doing and extracting more and more from the technology that is available, and delivering an optimized solution. So obviously there's a requirement to make sure that the technology and solution is sized correctly, is fit for purpose, that we're not over provisioning, and some of the capability of Cloud Foundation affords quite intelligent decisions how to invest in certain elements of that platform. So you're not having to make a full 5-year investment up front. You've got options there to grow and develop that platform over time. So moving on to the technology, and in particular kind of what the technology was that we delivered. So I think it's pretty obvious from kind of the people on the call that the VMware solution that we delivered was based on VMware Cloud Foundation. Marty's talked a little bit around some of the higher level, wider pieces that product delivers. But Gloucester had a number of requirements that fit into broadly 4 areas that we see when we're engaging with customers, not just within NHS, but generally around Cloud Foundation and what it can deliver. And they are security and compliance, consolidation, standardization, kind of cloud transformation and cloud journey, as well as disaster recovery and business continuity. And initially, Gloucester's requirements were primarily around DR, but also consolidation and standardization. And they had a disparate footprint of infrastructure services. They had challenges around delivering zero RPO and no data loss recovery services. So that was initially the reason that we selected the VMware technology stack, the Cloud Foundation product. But quite quickly, it became apparent that there's a lot more that could be achieved with this technology. So, for example, security with security compliance, it wasn't an initial requirement, but Gloucester identified in conjunction with ourselves that they had some challenges around securing legacy systems. Those systems still had to deliver clinical systems, clinical applications. There was no way to kind of replace those, and it's the same across lots and lots of trusts that we work with. But there was a need to make sure that they were secured and they could still deliver around compliance and obligations from the likes of NHS Digital. So using NSX to deliver micro-segmentation services to protect those legacy applications, we could adopt a zero trust approach, so that those applications and systems would be as secure as is technically possible without replacing them, allowing Gloucester to continue to use those systems and plan over the coming months and years to replace those as and when required, rather than being driven by lack of vendor support. So it actually provided some better planning and control around how to manage and use those systems. And Gloucester also had, like many trusts, challenges around how to continue managing these systems and trying to move from a light, kind of keeping the lights on IT function to actually delivering IT business change. And so by using a consolidated platform like Cloud Foundation, it simplified the technology stack. It brought disparate systems into one product portfolio, allowing Gloucester to deliver IT relatively easy with the in-house skills, but freeing up resource and capacity to focus on more important programs like EPR, for example, and some of the clinical access systems, which Mark and Mark will talk about shortly. But we've seen things from other trusts. So not everything in the technology, like I said, for Gloucester was needed in terms of their requirements. But we've seen a number of other things from other trusts that we work with around data center consolidation. So where trusts have the ability to use data centers across maybe multiple hospitals or multiple areas within their kind of campus, there is a need for certain trusts to look at consolidation of that DC footprint, and that's driving cost savings and efficiencies. But also customers who are wanting to adopt cloud services but don't really know exactly what they want, and there's a requirement to still deliver IT service in-house, but they need to not shut the door on the future. So Cloud Foundation affords that choice, with a selection, a very wide selection of those hyperscaler public cloud, those public cloud providers. So really kind of broad set of capabilities within that product that Gloucester and as I said, other trusts are able to take advantage of. So what did that mean in terms of outcomes for Gloucester? So I'm going to talk a little bit about kind of the functional and technical outcomes, and Mark will talk in the Q&A about kind of the clinical and patient outcomes. But there were two key requirements from Gloucester initially in terms of what they were looking for, and that was around disaster recovery and their fragmented platforms and the disparate systems that they had initially. So key requirement for Gloucester was to deliver seamless disaster recovery service, and Gloucester in a fortunate position where they had multiple hospitals and could leverage the geographical distance between those hospitals to deliver resilient DR services. And we provided, it was actually a world first in terms of the solution with Cloud Foundation Stretch vSAN, to deliver metro resilient solution between those two hospitals, which provided zero data loss for all applications. But the benefit of vSAN was that Gloucester could choose by applicational service what level of DR they wanted to provide, which provided really significant flexibility in terms of how they can provision DR for those applications and services. And the other one was fragmented platforms. So lots and lots of systems that have grown organically over time. There was a need to consolidate and rationalize those systems. There was lots of different technologies to support. It required lots of different skills, which put pressure and burden on the IT department, meaning they were struggling to respond and be able to provision new services rapidly and quickly. So Cloud Foundation at its core is a hyper-converged platform. So consolidation of those technologies into a couple of products and technologies, and Gloucester, in conjunction with the work that we did with VMware and ourselves, were educated and trained how to deliver that technology in-house, and so they were self-sufficient to manage everything that platform could do from kind of day one. And then there were three other things that came slightly as we went through that engagement approach. Gloucester themselves didn't necessarily realize they needed or could achieve with this same investment decision, and that was secure and unsupported systems. So I'll touch a little bit on that in the last slide, but leveraging NSX with microsegmentation to secure those legacy operating systems, those legacy applications, but also provide consistent security. So removing some of the human error that can come with service provisioning, so that all new services and systems that Gloucester provisioned came out of the box in a secure fashion. So it was a really quick, I won't say quite a quick one, but a very sophisticated way to deliver shorter timescales and consistent security operations. And then this path to cloud, so making sure that the door wasn't closed on where Gloucester wanted to go next. There is appetite to consume cloud services within the trust, and they are doing so already. But making sure that that choice and freedom of choice is maintained, and the platform that we delivered allows Gloucester freedom of choice for all of those hyperscalers that Martin Hosken talked about in his deck. And then finally, something that actually was quite significant, this ability to deliver shared services to the wider trust. So Cloud Foundation allowed Gloucester to act as a service provider, both for the hospital as well as the wider region. And it's something that they embraced quite early on, and that allowed them to deliver secure multi-tenant services across different regions and areas of the NHS within their trust. And that afforded them the ability to consolidate budgets. It also allowed them to start embracing the cultural shift to operating like a cloud provider and a consumer. So this mindset of consumption-based IT and how that needs to be managed, the operational impact, and how the culture within the trust needs to start changing as and when they want to consume cloud in the future. It puts them in a very fortunate position as and when they're ready to kind of take their next step in their cloud journey. So with that, I'm going to hand back to Mark Howie for the final section. So Mark, will now pass back to you.
Thanks, Martin. Yeah, very insightful, and you know, to both of you guys, really good overview of kind of you know, the value of this technology. And as I said, we're really proud of some of the work we've done with all of our customers within the NHS in terms of you know, helping them adopt this stuff to glean real value and improve outcomes. So yeah, welcome, Mark Hutchinson. You know, thanks again from me, Mark. You know, personally, in terms of taking an hour out of your day, I know you're really busy. You know, yeah, obviously really interested in hearing from you, you know, directly in terms of sharing your story, you know, over the past, what is it, three and a half, 4 years, I think you started way back when. So, you know, it'd be good to kick off, I think, you know, good, I guess, for you to talk a little bit about the digital journey so far for Gloucester, you know, where you kind of were when you took over the helm, and where you've come to now, and a bit more about where you see things in the next 2 to 3 years. But also, you know, if you could maybe reference that back to how the technology has helped you to, you know, A, deliver on that journey, but also B, you know, how has it helped to improve the outcome, you know, of the patients you serve in the local area?
Thank you. Thanks for the welcome. Thanks for inviting me along today. I think it's fair to say that Gloucester might have been described as digitally challenged when I arrived here 3.5 years ago. An organisation that was recovering from a pretty disastrous PAS implementation on the back of probably 10 years of not investing in much really digitally. We had network switches that were, you know, more than 15 years old, 3,000 PCs that were more than 6 years old. We had a really difficult environment that needed fixing quickly. For us, yeah, digital environments in a hospital are all about how we can help to improve the safety and the reliability of patient care. And an organisation that rates the digital maturity of hospitals across the world is an organisation called HIMSS. And so we got an assessment done to measure our digital maturity not longer after I got here. And I think it's fair to say we got a record score, in that it's the lowest they'd ever recorded anywhere, of something like 0.02. But that was really helpful for us. It helped to kind of explain to the organisation that we needed to take some steps quickly. We agreed a fairly ambitious goal to get to level 6 within the space of 3 to 5 years, and we needed to address our infrastructure so that we could implement electronic patient record systems on something that would work. There was no point going off and buying you know, a shiny train and having no tracks to run it on. So investing in infrastructure that people don't see so that the electronic patient record that they do see works and works well has been really important. We went live with nursing documentation after a very quick implementation project of I think 5 months at the end of 2019 at the Gloucester site, and then in February 2020 at Cheltenham, then went live with EOBS just as the pandemic was starting. And as I look back, I realised that the vast majority of our EPR programme has happened thereafter in the middle of a pandemic. We rolled out order comms last summer. We went live with the hospital discharge service solution in May this year. We went live with EPR in our ED at Cheltenham first in March this year, and then in Gloucester in July this year, and we're heading towards doing electronic prescribing at the beginning of next year. And we've got some great tales and accounts of how the systems that we've put in place have been able to make a difference for our patients. The junior doctor who's on their own overnight, based at just one of our sites 10 miles from the other, has been able to observe and then intervene in a patient's deterioration, because that information is now visible to all in a way that was never possible when the paper notes at the foot of the bed were the only way you could keep track of a patient. And there are numerous stories. For us, there are, of course, inevitable glitches. Some of the automation solutions that we put in place to make ED work proved probably not to have enough horsepower that they needed. And the great thing that we've been able to do with you guys is instantly scale up something from running effectively 1 thread to 8. All of the horsepower, all of the the solutions behind that, and the scalability of that was being down to what you've helped us put in place here. And I think I've lost count now of the number of times where somebody I find out via some exec WhatsApp message that we've had a blip in electrical power, or we've had a problem somewhere on site, and I text to find out what the impact is for our electronic patient record that people need to have there all the time, and I'm told that the system automatically effectively failed over and it's all running out of Cheltenham now. It's 10 miles away and nobody even noticed. The clinicians on the wards are still noting, still ordering tests, still getting results back, still being able to manage their patients successfully on the patient record system that we put in, because of the infrastructure that sits underneath that, that's so essential for us if people are going to be able to rely on it every day. And I guess the other thing, this is a long answer to the question, sorry Mark. The other thing that we've been really keen to push on with, obviously, is remote consultations, as we move the need, or progress towards removing the need for care to have to happen where the paper notes are. The other thing we can do is save patients the need to come on site here. Indeed, during the pandemic, save the clinicians the need to come on site here at times, and so the clinician could be at home while the patient was at home, and the outpatient service could continue as a result of the virtual desktop infrastructure that you guys helped us implement so quickly.
Yeah, thank you. Really, yeah, I mean, you called out, 2 or 3. I talked about being proud in terms of the solution. I think that one you called out there with the remote control. I've got a bit of an echo for some reason, but we had, I think it was something like 2 weeks we were able to mobilise that part of the service. I think you give us a bit of a stretch target, I think, around it, if I'm being honest, which is not like you, Mark, but to be fair, the guys really stood up, both your teams and ours. Clearly you understand the sort of magnitude of a request like that, and the importance, and having to avoid vulnerable patients coming into hospital, or a doctor who's isolating because the kids come home from school and have to stay home for 2 weeks, that kind of stuff, but can still work. It's super important, isn't it, really? So yeah, it's. Were you going to interject there? Sorry, I thought you were going to interject, Mark.
Yeah, I was just trying to work out how to unmute, sorry. Yeah, absolutely, because at the beginning we wanted to send 2,000 people almost overnight to be able to work from home. I was actually outside in the car park of another NHS organisation, which I won't name on this call, and I watched as a pallet truck of laptops fell off the back of a tail lift across the car park. But it was a picture of how many hundreds, and for some organisations thousands, of laptops that were being bought at the time by NHS organisations so that their staff could work from home. And yeah, I do like a tight deadline if I can. What we set ourselves and what you guys were able to do was take a 9-month project of creating a virtual desktop infrastructure and do it in 9 days. And so the people who we sent home didn't get sent home with a brand new laptop that we just spent hundreds of pounds on, but instead they were sent home to use whatever device they'd got at home, so that they could access the virtual desktop and work from there. And inevitably there's some challenges in that. If you do something, if you do 9 months work in 9 days, there's going to be a bit of tidying up to do. But what we haven't done is throw that away. That served us really well over the last 18 months. And what we're doing now with the second iteration of that is creating something that's fit for what we're moving towards, or really where we are now, which is not a workforce that works entirely from home, but nor is it a workforce that is spending all day back in the hospital. We now need something that's flexible and can work in a hybrid way, so that you have the same experience whether you're at work or whether you're at home. And so that second iteration that you guys are supporting us with is really important, so that we can not just continue for staff to be able to benefit from the flexibility of being able to spend part of their week at home. There's an environmental benefit to that. There's a staff well-being benefit to that. There's also a benefit because we can use our estate differently, and as well as being able to provide remote consultation. So there's so many different benefits that we're able to deliver as a result of being able to make that our new kind of standard way of working, that simply wouldn't have been possible without your enabling and support.
No, thank you, and I agree. And I think I don't like to coin the phrase "one good thing to come out of a pandemic," because there isn't a good thing. It's a pandemic. But I think you guys are a prime example of this. I think the way you approach the adoption of technology, rather than just going out with a knee-jerk reaction of buying 1,000 laptops, how can we do this a little bit cleverer, and how can we utilize some of these great digital tools that we've got to mobilize the workforce now, but it's obviously set you in such good stead now, as we work through this second iteration in terms of all the use cases and benefits you're going to get out of that. And it kind of leads me on to the next question I wanted to, or topic I wanted to kind of put to you to cover off, and that was going back to what Martin Ingham said around when we first met you guys. And I think when you first took over, there's a big emphasis in terms of that collaboration with local healthcare providers, the CCGs, the GP surgeries, mental health, social care, and obviously there's lots of rhetoric and sort of legislation that comes out of central government around the promotion of this, ICS, the birth of the ICSs and all that kind of stuff. But I know that it's something that is very important to you personally and to the management team there at Gloucester. And I guess it was just to understand a little bit more about how this technology has helped you to promote that, I suppose, and I guess get a little bit closer with some of these local healthcare providers that you want to collaborate and work more closely with.
Yeah, we talk a lot about integration, don't we, in terms of joining up healthcare using technology to connect up different health settings. Which is a great thing to talk about in presentations, but if anyone's ever been to a different part of the health system with an elderly relative, you realise that primarily we rely on elderly people's brains to join up healthcare systems. It's not the way it should be, is it? But we ask the patient and what happened at the hospital. We ask the patient what happened when the district health visitor came into your house, or when someone from adult social care came into the house, and then we make potentially quite important decisions on the basis of what they can remember from their last interaction, which is serving people really poorly. And so it's vital that we can present to any caregiver across the county as complete a picture as possible of what's happened to their patient. Now that's not straightforward from a system point of view, but one of the things that so often trips us up is a lack of consistency in our infrastructure between social care, between primary care, between community mental health trusts, and between hospitals. And one of the things that, absolutely you guys are enabling us to do is have that conversation across Gloucestershire. How can we standardise a desktop experience? How can we make sure that whichever building you turn up in, if it's owned by the public sector in Gloucestershire, then the user has a standard experience, and that helps us support the patient. How can we make sure that it's as easy as possible for people to access the record? As you say, we provide a service to the CCG, but also, I'd be quite keen to do that for other partners, and those conversations continue. But if we go back to the first 3 months of the pandemic, we were discharging patients, and it was really important that primary care, that the GP for those people were able to understand which patients had been discharged that day or that week after a stay with COVID in the hospital, and were able to ring them up or interact with them and keep an eye on them. And so instantly, because we had the virtual desktop infrastructure, we were able to give access to all of the GPs across Gloucestershire in all of the primary care premises via EPR access, but via your virtual desktop. And that meant that people who previously had not had access to that information now can do. And so it's led to a whole load of conversations about A, why did we only do that for COVID, and B, what can we do now? Because we discharge 90 patients every day, or we need to. So how do we make sure that we can safely pass them on to primary care? Indeed, how can we make primary care aware of, or community, or partners across the system aware of the people who are going to leave tomorrow or the day after or the day after, so that they can get a step ahead and prepare for discharge? Anybody who's ever been through the sort of challenges that I have with grandparents and other people in terms of getting frustrated with the pace at which health systems discharge patients back into homes or back into their own home will hopefully appreciate that this could make a massive difference, even if it just took 1 or 2 days off the length of stay of patients who often spend too long in a hospital. Can make a massive difference to their recovery, and of course help us. We're a hospital that some days has ambulances queuing outside. It's really important that we free up our beds, and enabling all of that through the technology that you've been able to help us implement is really exciting.
Absolutely, couldn't agree more. And thank you very much for all of that. Yeah, I think we're just running exactly on time by my reckoning. So yeah, as I say, once again, Mark, I'd just like to say thanks very much. Really proud of being part of your journey and helping helping support you guys. And I just also sort of a huge accolade for the delivery of all of those EPR modules through the pandemic. I think the way you and your team have been able to deliver that, whilst balancing BAU and obviously the impact of the pandemic is testament to the team you've built there. So yeah, congratulations and well done for that. And as I said, thanks again for your time. So I think Chris is going to open up the floor to questions from attendees, and that can be obviously aimed at any four of us on the panel, I believe.
Thank you, Mark. Yeah, as you say, now time to pass over to questions from you. And thank you everyone who sent your questions through. We'll not get through them all. We've only really got time for one, so we will answer the rest personally. This question is back to yourself, Mark Hutchinson. We've had somebody ask, is there anything you've learned on your journey, and is there anything you would do differently in hindsight?
Crumbs, I think I'd do everything differently. Personally, I think the biggest learning, and it's complicated and it takes time, but the NHS, in my view, and especially the beginning of a pandemic, drives people too often to answer very specific questions by bidding for very specific funds and to do very specific jobs. And I've got a great job. I think it's the best job in the hospital. But if we're going to take advantage of never having enough money, and so making sure we use the small amounts that we get, it's really important to take a step back. And every time we fix a small operational problem, do it with a strategic view. It would have been easy to buy 1,000 laptops, but what we did instead was build capability that will serve us well, I think, for the next 5 years with support from these guys. I bid for some money a few years ago for an electronic prescribing solution, but I didn't buy just an electronic prescribing solution. I put that money with other money that we got to buy an electronic patient record. That means that prescribing record is part of the broader electronic patient record that we're delivering on your platform. And if I've learned anything, there's been times when I've been tempted, or have occasionally taken the small amounts of money to do small what are seen as low-hanging bits of fruit, but end up further fragmenting the clinical record. And I guess it's our job as strategic digital leaders in the NHS to try and take advantage of what we can, but to always do so with a long-term strategy in mind, and not get too distracted by the shiny things that people want that probably aren't the best long-term solution.
Thank you for that, Mark. And as I said, we'll endeavour to answer everybody's questions privately that send them through. So thank you for them. And I'd like to pass you back to Mark, who will conclude the session for us.
Thanks, Chris, and thanks again to all you attendees, and obviously the other three panelists here for taking the hour out of your day to attend the session. Hopefully everyone's found it insightful and useful. As I said before, I'm personally extremely proud of all the work that I do with my customers. I've focused on NHS for the last 10 years, and it's a challenging sector to work in, as a supplier, and obviously working for the NHS. But it's super rewarding, and I think a lot of the stuff that you've heard Mark Hutchinson sort through there. It's just a handful of the successes that we've helped customers deliver in terms of improving patient outcomes. And I think it's something that's close to all of our hearts. I think Mark Hutchinson, you called out there about grandparents. I think I've had experiences when my wife was having children in hospital, where you kind of sit living in the world of IT and wonder how things could be done a little bit more efficiently, and getting her discharged at 9 o'clock in the morning, but then having to wait around for a prescription for some painkillers until the end of the day, because there's not there's paper at the end of the beds like Mark talked about, and you've got to go back to a terminal. All those things, and all the great work that the sort of the IT departments and IT leadership are doing within NHS Trust to transform that, and the part that we and the bit that we get involved in terms of helping to support that, as I said, makes me extremely proud. So as I said, thanks very much to everyone for attending. Hope you found it useful. There are a few handouts in the webinar area there that you can download, some stuff around hybrid cloud, and also there's a written Gloucester case study. There is a video available online that we did in partnership with VMware and Gloucester, and you can see mine and Mark's faces on there talking about all this stuff. Again, in a 3 or 4 minute video. So yeah, really interesting. Thanks again for everyone's time, and hope to see you all soon.